I'm Michael Coletta, Informatics Analyst with the National Association for County and City Health Officials. It's our pleasure to bring you Dr. Dave Ross, the Director of the Public Health Informatics Institute. I'd like to take a second to introduce today's presentation. I was privileged to be part of a PHII work group tasked to consider the future of surveillance. In order to inspire us, Dr. Ross presented his work that he and others had done in 1995 when they were asked to provide members of Congress a vision for the future of surveillance. Our work group discovered that this presentation was very useful in helping public health practitioners understand what public health informatics really is. It's our hope that you'll find this both informative and inspirational. Please welcome Dr. David Ross.
Thanks, Mike, for asking me to do this presentation. I want to thank you and your colleagues at NACCHO. Today, May 2012, our healthcare delivery partners are adopting electronic health record systems at a very fast pace. Their adoption of these systems, we know, will bring changes to the way we work and to the data that we use for surveillance. And they'll probably bring other changes as well. As a consequence, we need to ask ourselves, when and how must our information systems change to adapt to this new practice? What kinds of capabilities do we need to practice the best public health in the future? Well, we all know that information technologies change at a very fast pace. You may have heard of Moore's Law. Moore's Law suggests that the number of transistors placed on an integrated circuit doubles approximately every 18 months. So by extension, we see a doubling in the power of information technologies generally every 18 months or thereabouts, and then the potential that this new power can bring to the way we can do our work. So because technologies change very rapidly, many people will ask, how can you plan ahead? And certainly in public health and the public sector, this is a big challenge. How do we plan ahead? How do we think about where we should be down the road? Well, there is a way. And I think we have to understand that while we cannot predict the specifics of change, there are some general trends that we can predict. So I want to make this point that this unpredictability in the specifics should not prevent us from planning in the general sense, because we know that the power of these technologies continues to evolve and change and improve, and by extension that what we could do in the way of practice in public health can change. As Mike Coletta said, I want to show you a presentation that my colleagues and I put together back at CDC in 1995 as a way of explaining how we could envision public health practice being changed through the use of information technologies that were probably going to be in place in the future. So now I ask you to teleport yourself back to 1994-95, the year that the very first internet browser, Mosaic, was made available. And that was a time when very few people had access to the internet, and a time when many health departments were really struggling to do more than have a fax machine working, that they didn't have email, and they certainly didn't have connection to the internet. And it was a time when many hospitals at best had computerized departmental computing, like in the laboratory or in the pharmacy, to support the work of that department, but not connecting the whole of the institution, and certainly not connecting the institution to other institutions. In 1994-95, this was an era that was on the verge of exploding with the IT revolution, but it wasn't there yet. The promise of the IT revolution as a tool for most citizens was still largely a promise of the future. Large businesses had dedicated video conferencing networks in place, but those were really just the biggest, most profitable industries that had that at the time. the notion that you would have information at your fingertips was still a thought that was in the sort of in the realm of science fiction, and certainly we in public health really thought of it that way. And that the news media had one cable channel back then, CNN. So the idea of massive number of cable channels was still a promise of the future. So in this environment, we asked ourselves, what would public health do if we had access to this kind of future or futuristic, robust information infrastructure? And how would we do our work differently? So we concluded that we needed a visible vision, one that would allow others to see how public health could be practiced if we had access to these kinds of tools. We chose to set our health department of the future in the year 2010, a time that seemed so distant, wherein a technology infrastructure existed. Then we set about to demonstrate and ultimately to gain agreement among leaders in public health practice back in 1995 that this futuristic vision might be a good thing. So now I want you to put on your 1990 eyes. We'll share with you the vision that was created in 1995 for the year 2010. So we're going to look ahead. So join me on this journey. We were at the time thinking about building learning communities by using health information. We were talking about leading with a vision and improving access to, at the time, CDC expertise, but now we would think of as public health expertise, broadly. And that we would build learning communities that support health. Sounds sort of like the health reform legislation of today.
Place your dominant thumb on screen now. Verification complete. You are cleared for entry. Good day, doctor. Today is May 10th, 2010, the 10th anniversary of the global eradication of polio. Priority 1. Finalize the Cobb County Heart Disease Initiative.
Well, now that it's 2010, we know that we've got a chronic disease burden, and heart disease is my major initiative as health officer. So my systems are helping me get ready for the day and helping me guide me towards working with my community to improve our effectiveness in our heart disease work.
Rover has detected an increase in positive lab results for E. coli 0157H7.
Well, our expert system, we call him Rover. We've personalized him. He's found a problem for us. We have an E. coli problem. Now, that's a serious issue. We've been doing such a great job containing these kinds of infectious diseases. It's been a long time since we've seen this, but this is really important. This is a serious illness. So let's go over to our surveillance bar and see what we have in store. Well, it appears as though right here in the middle of northwest Georgia, Cobb County and surrounding counties, we've got a number of confirmed cases and a growing number of suspected cases. We need to take a look at our expert epidemiology system to see what this apparent outbreak is all about. So I go to my virtual epidemiologist, and what it shows me is that we can, through the help of the system, get help developing a case definition if we need it. We can get help gathering data. The system will help us analyze and interpret data. It will show us results, and it will help us with recommendations. And it will give us access to information resources of many kinds. This is very useful. But since we know we've got an outbreak, let's go and work on gathering data. And what our system does is show us that it can help search electronic health records, because now, of course, we've got automated hospitals and we've got the internet everywhere and connectivity between health systems linked to public health. And so we have that ability to reach out and go to specific records if we knew a specific case. But right now, I think what we need is some help with developing a survey. So I'll go to our survey options. And what our system has now done for us is bring up the past surveys and give us a first proposed survey of questions that we're going to push out through the network to the community and to healthcare providers to help us in proceeding with this outbreak. You remember back in the old days, back in the 90s and 80s, we had to send out investigators right off the bat. Well, now we can start that outbreak investigation using our systems. And I even have the ability through this system, this is great, isn't it? I can append a message. So I'm just going to go ahead and append a message and video this comment. Hello, I'm your Cobb County Health Officer. Our community is experiencing an unusual increase in the incidence of E. coli infections. The Cobb County Health Department is working with your doctor to investigate this outbreak. We need your help by cooperating with your doctor and health department officials as they search for a cause. Thank you very much for your assistance. And now with that, I'm going to go ahead and send the survey out to the community's doctors, to the hospital providers, and we're going to start to get their help. Well, it's been a long time since we've experienced this kind of an outbreak. I mean, the upside to good public health work is we don't see problems. And that's what we're now confronting, is that it's been a long time. So I need to brush up on the facts. So let's go over to the virtual learning environment and get some help. Well, you know, these systems are really smart. This system has known that we have this outbreak underway, and it put E. coli resources up front, right off the bat to help me. So let me go there and see what I can learn. Well, it has information on prior outbreaks. This is very helpful. So let me get some ideas. Go to that, click on that one and see what we've got.
In January 1993, the intensive care unit at the Seattle Children's Hospital was flooded with children on kidney dialysis fighting for their lives. Unknown to the doctors there, similar scenes were occurring in 3 other states. These children had had the misfortune of eating fast food hamburgers contaminated with E. coli 0157H7.
Our system also has information on background science that I can now push out to my laboratorians.
Definition, these are E. coli that produce sugar-like toxins, also called virotoxins, and produce attaching effacing lesions. 0157 is by far the most commonly identified serotype in the class.
So that's going to be very helpful to our scientific staff. But what's really important is that we can go to some guidelines and send guidelines out to the general public. For example, we can let them know and let the press know that they need to cook all hamburgers and ground beef thoroughly. And that if they encounter any uncooked hamburger in a restaurant, they need to send it back. These kinds of recommendations we are going to get out in front of the public fast. And of course, we've got recommendations that can go to the professional community, like the right kind of cultures to use. Well, now that this has been, I think, extremely helpful to have this. Well, and here we go.
A related news story on CNN.
Well, this is the modern time, isn't it? The press gets hold of everything pretty darn quickly. And already now Rover's letting us know that CNN's going to carry a story. So I need to go to my communications bar and see exactly what CNN has found. So let's go over here, and in our wide range of media that we now have access to, I'm going to click on CNN.
Nell Thomas reporting for CNN. 25 children at Bells Ferry Elementary School went home today, complaining of gastrointestinal pain. The children had been on a field trip to the Mars Shuttle Station in downtown Marietta. A Priority 1 outbreak team is already on site.
Well, as health officer, we all know that one of our challenges is to work with the public and work through the press. We don't these days have time to work an outbreak for a good while before we talk to the press. It's immediately in the public. So we're going to have to deal with the press. We're going to have to put forward guidelines and facts on an almost instantaneous basis. But fortunately, we've got the tools to help us do that. Well, let's project forward now. We're now later in the day. We've had time to gather data and begin to understand this outbreak better. So let's go back to our virtual epidemiologist and take a look at what kind of analysis and results we may have to help us understand where we are in the outbreak today. So look at this. The preliminary analysis already has zeroed in on what appears to be a point source of the outbreak. This is very, very helpful. We have now been able to know where to focus our resources. We're sending out our investigators from the health department. Our epidemiologists are working with the doctors of the community in the hospitals. It looks like we've zeroed in on the source of this outbreak. With this, folks, I think you get the idea that we were trying to put together. And so with that, I want to come back to the present. This scenario that you've just seen was put together in 1994 and 1995. We did that as a way to say, what would public health practice look like? How would it function if we had these tools? And now we come forward to 2012 and say, how close were we to getting it right? And is the vision of practice that we put together back then really a vision that makes sense? With Rover, we were looking 15 years ahead. And we were trying to guess how much change would really take place and what it would mean to public health. So what did we get right? Well, for one thing, our expert systems today look a lot like the predictive intelligence behind many of today's online tools. We included that. We had our distance learning or our virtual learning environment as that analogy. So the search engines today, like Google, they predict what you're looking for. They complete what you're typing before you've typed it. And they do this based on what they have learned by other people searching and what searches you've done. Think about how when you go to Amazon, how that works. For another thing, we really fully predicted the interactive multimedia environment. Think back to what I said at the beginning of my talk. These technologies are predictable in the general. Now, we couldn't have guessed there was going to something called Google come along. Never would have thought of that. But we were able to say, we know there will be the ability to put your hands on a lot of literature and resources. And at the time, we used to talk a lot about the gray literature and how do you get access to this non-peer-reviewed, non-indexed literature. It had seemed to be an insurmountable problem. But we said, well, 15 years in the future, maybe we'll be able to do that. So let's think, if we could, how would practice work? Probably the most important thing that we got right here was that we had a vision, we had an obligation to put together a vision for the future. Because having a visible vision is something that can propel public health practitioners to begin to think about how to take advantage of technologies as they come about. Because what our job is, most important job is to take advantage of these technologies, not to try to invent them ourselves, but to be aware that when they come about, they're going to open doors for how we practice. And that's really where we are today, isn't it? We are at a health system that is being connected electronically. We are going to be able to understand disease phenomena in a different way. And so we have an obligation to act today. But I think we also have an obligation to think ahead. So as I close my presentation, I would like to ask you to think, wouldn't it be a good idea if we thought ahead another 15 years and said, what should practice look like then? As a way of helping us, the public health community, be prepared to use these emerging technologies. And I also have one other thought I want to offer to you, and that is that those of you who are public health practitioners, whether you're a health officer, an environmentalist, a nurse, a maternal and child health director, whatever your role is within public health, the lesson that I really want to leave you in the local health department community with is that we won't be able to get the use of these technologies right unless you get involved and help drive that destiny. It is in service of the work you do that we must put these technologies. And if you're not involved, then we're going to do a bad job of it. We'll fail. So having you involved, working with groups like my institute, will help make sure that we create a good use of these technologies. And with that, I want to thank you and thank NACCHO for asking me to speak.